رمضان كريم وكل عام وأنتم بخير. Thank you for joining us today for this panel discussion on health misinformation and disinformation in honor of World Health Day, which is celebrated annually on April 7, and each year it draws attention to a specific health topic of concern to people all over the world. My name is Mohammed, and I will be moderating this session. And I'm delighted to be joined today by two distinguished speakers, Dr. Skyler Johnson from the United States, Assistant Professor in the Department of Radiation Oncology at the University of Utah, Huntsman Cancer Institute. Thank you for joining us, Dr. Johnson. And we have with us from Qatar, Dr. Hadi Mohamad Abu Rasheed, Head of the Professional Development and Scientific Research Department and the Scientific Advisor of Qatar Cancer Society. So we have the American perspective and the local Qatari perspective, and hopefully we will have a great discussion today, and everyone will enjoy it, hopefully. So I would like to start to turn the mic to my colleague, Brandy, from the medical unit at the US Embassy to provide welcome remarks. Good morning, Brandy, and thank you for being with us today. The floor is yours.
Good morning, everyone, and thank you for including me in this very important discussion that we're going to be having today. Our discussion this morning is incredibly timely and important. For more than 2 years, misinformation and disinformation has led to catastrophic results as many people continue to lose their lives to COVID-19, due in part to being misinformed or even intentionally misled into believing vaccines and masks don't help mitigate the spread of the virus. Amid the numbers and statistics, we must remember that human life is precious. Lives lost due in part to intentional or unintentional spread of false information results in someone somewhere losing a loved one or even a friend. Imagine how many children are now without a parent, or how many parents have lost a child. The unfortunate reality is that misinformation and disinformation concerning human life was unfortunately spreading long before the emergence of COVID-19 and had a great impact on people's willingness to seek treatment and preventative care for diseases like cancer. From distress of medical providers to fear generated about the use of technology and treatment, a multitude of reasons exist as to why misinformation and disinformation are disseminated in regards to diseases like cancer, which is actually the focus of our dialogue this morning. Social media and the internet have also become platforms where the sharing of misinformation and disinformation do so quite easily, with the ability to reach millions in some instances. The Centers for Disease Control and Prevention and the World Health Organization and the Mayo Clinic are consistent and reliable sources of general medical information online. Encouraging people to visit the websites of regional hospitals or their government's Department of Health for more specific information on health is important to countering the spread of misinformation. When used appropriately, the digital age and technology present unique opportunities to counter the spread of misinformation and disinformation. As knowledge translation tools, they can also expand factual information to help guide patients and their support networks concerning decisions making for care and treatment. When meeting with patients who face the reality of cancer diagnoses and treatment, evidence-based shared decision-making is vital, and they are important tools when seeking information about disease and treatment options. Often as healthcare professionals, it's also important we emphasize the importance of holistic health in the form of discussions about mental health, social support groups, counseling, and mental health treatment to bolster our patients' well-being while undergoing cancer care. I know we have a very valuable discussion ahead, so I will stop here. Thank you to Dr. Abu Rasheed and Dr. Johnson for joining us this morning, and welcome to everybody in the audience. We hope you find this exchange informative and useful.
Thank you, Brandy. Thank you for this rich welcome remarks, which is a great introduction to our session today. And welcome everybody who are joining us on Zoom, and also the community who are joining to engage with us on social media. I would like to remind you that you can submit your questions in the chat box of Zoom, but also in the comment section of the Facebook Live. So please submit your questions ahead of time and we will share them with our speaker. So with this said, I will turn the mic over to Dr. Skyler Jonsson, but I will start to give like a short background of Dr. Jonsson researches. So Dr. Jonsson is an international expert on cancer misinformation and disinformation, and has served as a panel member and invited speaker to students, faculty, and community members across the world. His prior research on the use of unproven cancer treatments garnered national and international media attention from the lay press and resulted in over 350 news stories. He and members of his research team conducted television, radio, and print interviews with NBC, CNN, NPR, BBC, Time Magazine, Reader's Digest, among others, and it was prominently featured in the New York Times. More importantly, the research addressed an unmet need in the oncology medical literature and has been used in health policy documents, including the World Health Organization report on cancer. This research led to a study in collaboration with national cancer experts quantifying misinformation and potential for harm contained within cancer articles on social media, as well as a multi-institutional intramural grant identifying sources of exposure, motivation, and perceptions of complementary and alternative medicine use in cancer. So Dr. Jonsson, I can keep talking about your research for a longer time, but I will turn the mic for you. And thank you again for being with us today. And thank you for sharing your valuable experience and your valuable time to talk about this very important subject today. Over to you, Dr. Jonsson.
Thank you for that very kind introduction. Just 1 second while I share my presentation slides with you. I am very grateful for this opportunity to talk about misinformation, particularly in the area of cancer and that misinformation which is found on social media. It's a very important and timely topic, as was previously stated. So thank you specifically to the U.S. Embassy in Doha for this invitation to speak about this important issue, and the Qatar Cancer Society as well. So I have no financial conflicts of interest to disclose, but I wanted to start this discussion with a case. And I feel like discussing this case is important because it can provide context for some of the issues that cancer providers may face and the impact that cancer misinformation can have in the life of an individual patient. So just as a disclaimer, this is a case, and details of the case have been changed to protect the privacy of the individual involved. This patient is a 38-year-old female, and she first noted that she had a mass in her left breast in about 2017, late 2017. And this mass was confirmed with traditional physical exam and imaging findings. A biopsy was recommended. However, the patient declined the biopsy because she had heard from a trusted family member who read online that a biopsy would spread the cancer, if it was a cancer, and make it worse. Despite the best efforts of doctors at that time, discussing with her that decision, she opted to forego biopsying the breast mass and wanted to treat that mass naturally with a raw food diet. Unfortunately, approximately 18 months later, she came back to the doctor's office. She had a painful mass now in that breast, and there was some skin redness and some bloody nipple discharge as well. There was some imaging done at that point that confirmed that there was some, and this mass was enlarging and that there were some lymph nodes involved. She did eventually agree to a biopsy, which showed that she had a triple negative breast cancer. And at that time, it was recommended that she undergo traditional cancer treatments to give her the best chance at cure. In early stage breast cancers, obviously, depending on the type, the survival can be anywhere from 50 to 90% or even higher in some cases. And in this case, as she delays treatment, the chances at cure become less likely. She declined treatment at that time in favor of IV vitamin C. And again, despite the best efforts of physicians, they were unable to change her mind. She returned to the doctor's office just a few months later, and she had skin redness now of the entire breast. There's nodules that looked like they were breaking through the skin, but the patient had been told by the alternative medicine practitioner that was giving her IV vitamins that this was her body's natural way of expelling the tumor. And the patient continued to decline the recommended cancer treatments like surgery, chemotherapy, and radiation. And the family eventually paid for her to travel outside of the United States to a place in Mexico for what was referred to as hyperbaric oxygen and natural chemotherapy. The details were not clear. Unfortunately, the patient returned just a couple months later, and she came back to the emergency department with severe back pain and hip pain. And she had basically this history while she was in Mexico where the mass had bled uncontrollably, and she had to undergo an urgent surgery to control the bleeding. So she had what we would refer to as a palliative mastectomy. And she continued to believe that her body was expelling the tumor from her body naturally. Unfortunately, the back and hip pain was discovered to be widely metastatic breast cancer to her bones. So despite her initial 5-year survival, which, as I stated, was anywhere from 50 to 90%, depending on some of those unknown factors, now she has what we would say is a 5-year survival of 10%. Now, between the subsequent 6 months, she did eventually accept some of the palliative conventional cancer treatments that we recommended, including chemotherapy and radiation for some of her pain. But following an initial response to treatment, she eventually developed disease to her brain and died. And this is a very sad case. Now, in this case, there's multiple instances of misinformation, but despite the best efforts of physicians, the patient could not be convinced to consider evidence-based treatments until, frankly, it was too late. Now, this case may seem as though it was selected to sensationalize the issue of misinformation. Unfortunately, it's not a unique case, and the themes within it, namely the desire for natural treatments or declining recommendations, believing things that are said by family or friends that are perceived to be trusted sources, misinformation found online, the use of precious time and resources to travel internationally for unproven cancer treatments are anything but rare in medicine. Unfortunately, there's little data to guide patient care in this space. And misinformation, as illustrated here, can have deadly consequences. And from a clinical perspective, we often encounter patients who are processing through multiple information gathering stages. And fortunately, some of the information that they're encountering is not reliable or credible. So this brings up, obviously, the issue of cancer communication and misinformation. And in 2016, almost 90% of respondents in a survey felt like fake news, things that they were reading about online, was creating confusion about even the most basic of facts. To illustrate this issue, the American Cancer Society, or the American Society of Clinical Oncology, rather, did a survey asking people whether they felt like their cancer can be cured with unproven cancer treatments like herbs or dietary changes, things that have no evidence to support their use. And 40% of respondents felt like this were true, that they could cure their cancer without, conventional cancer treatments. To highlight this issue, the National Cancer Institute has released research priorities to address the misinformation in the age of social media. Namely, what's the prevalence of cancer-related misinformation? How do individuals process that information, and how do they realize whether something is credible versus not? And what are the most effective ways to address the misinformation on various platforms? And these are indeed the essential questions that need to be answered if we were to tackle misinformation online in this ever-changing media environment, because what people believe to be true matters, particularly when it's about cancer. And no matter how advanced our treatments are, people will not benefit from them if they decide not to take them. So our research team attempted to address this by basically polling what were the most popular cancer treatment related articles on social media and reviewing those cancer treatment related articles for accuracy and for safety. And what we learned was quite shocking. We reviewed articles that were published on Facebook, Twitter, Reddit, and Pinterest. And when reviewing these social media sites, we found that nearly 1/3 of all cancer treatment related articles contained misinformation. We described the types of misinformation that you can see here. They were misleading or mischaracterized or supported unproven therapies. Further, 30.5% of these articles contained harmful information. And that's something that's quite shocking. And if you looked at just the articles that contained misinformation, the vast majority of those, nearly 77%, contained harmful information. So again, among articles containing misinformation, 77% of those contained harmful information. Now, the most surprising finding of this study was that when you looked at the association between cancer article misinformation and harm, and how much attention these types of articles received, the articles that had misinformation and the articles that had harm received more engagements, meaning shares, likes, comments. They were the articles that basically were harmful, and the articles that were not true. And the articles that were accurate and the articles that were safe did not receive as much attention. And this was quite concerning for us. In a summary, 1/3 of the cancer articles on social media contained misinformation, and the majority of these contained the potential for harm and received more online attention or engagement compared to the true or safe articles. So we're currently in the process of looking at the article-specific claims and the article features as predictors of misinformation. And many of the claims classified as misinformation and harmful misinformation were what we refer to as unproven or disproven treatments, and or even the refusal of conventional cancer therapies like surgery, chemotherapy, and radiation, which is similar to this case that I presented at the beginning of this presentation. Unfortunately, there's really limited evidence to guide informed consent in this space. We did, however, study this. So in the United States, there's what we refer to as this large national database that collects approximately 70% of all new cancer diagnoses, including anonymized demographic information, clinical information, and treatment-related information. And you can look at patients' survival outcomes. And within this database, you can identify groups of patients who used unproven cancer treatments, which we defined as alternative cancer therapies. And these were therapies that, unfortunately, a subset of patients used between our study period of 2004 and 2013. We excluded patients that had metastatic disease and only looked at the 4 most common cancers in the United States: breast, prostate, lung, and colorectal cancer. And we looked at these cancers, we noted some alarming trends. And this is, although they were alarming, not particularly surprising, because we've seen these anecdotes over time in our practice. And that's that patients with breast cancer had a much worse survival at 5 years if they chose unproven cancer treatments or alternative cancer treatments as listed on this graph versus conventional cancer treatments. A 5-year survival of 58% versus 87%. These trends were similar for other cancers, like prostate cancer, although it was non-significant. There was a 86% versus 91% 5-year survival when using alternative versus conventional cancer therapies. And then when you looked at lung cancer, you had a 20 versus 41% difference in 5-year survival. And for colorectal cancer, you saw a 33% versus a 79% 5-year survival difference. Now, the thing that's most shocking here is that everybody who's on the dotted lines are those who use conventional cancer treatments as recommended by their oncologist, but the people in the solid lines are those who used unproven cancer treatments. And it's sad to note that each of the drops in that graph are individuals who died early and unnecessarily because they used unproven cancer therapies. Now, when we controlled for cancer type, race, insurance type, facility type, stage, comorbidity, the receipt of using an unproven cancer therapy was independently associated with a greater risk of death. And this was, shown throughout the number of different cancer types. And in conclusion, when using unproven cancer treatments and foregoing surgery, radiation, chemotherapy for the primary treatment of curable cancer has a greater risk of death compared to those who chose proven conventional cancer treatments. And no matter how advanced and effective cancer treatments are, again, people will not benefit if they decide not to take them. Now, here's another case that I would like to share. So here's another example of what happens. This story is shared with permission. This is LJ. She's a 27-year-old female who was diagnosed with a Hodgkin's lymphoma. And like many others, upon hearing her cancer diagnosis, she immediately went to the internet along with her husband to learn more. And unfortunately found on Google that there's lots of misinformation out there. Fortunately, because I was her husband and I had some medical school training at the time of her diagnosis, it had prepared me and her to kind of quickly sift through the massive amounts of misinformation online and helped us identify what was accurate information. And this is my wife now. She's since been cured of her Hodgkin's lymphoma. She's doing very well. She's now celebrating a 10-year cancer-free anniversary. And this, we've, obviously are very fortunate because she is, in a position where she had access to great medical care, had great physicians. Her previous experiences had led her to trust in the physicians that were providing her advice. And, 50 to 60 years ago, she may have died from her cancer, but with the accurate treatments that we have, or the good treatments that we have, the survival rate for her cancer is as high as 85%. So in contrasting those two cases, what do we do? Because clearly addressing misinformation is of utmost importance. Here are some of the strategies that I feel like we need to address cancer misinformation. The first is to look at the cancer misinformation itself. We need to improve the surveillance. We need to automate identification of misinformation for our patients, look at predictors of misinformation so we can help patients sift through what's accurate and inaccurate information, and look at who's sharing misinformation to see if we can provide interventions to prevent that in the future. And then we need to identify patients' discriminatory ability. Can they tell what's accurate and what's not? What are ways that we can assist in that? Who are the populations at risk of believing misinformation? What are their psychological drivers? And how can we prevent or inoculate them from being impacted by the misinformation that they will inevitably encounter? And lastly, how do we work with physicians? And how does this misinformation with their patients impact therapeutic relationships? How confident, competent, and helpful are physicians when they are when misinformation is brought to the office? And how can we improve patient-physician communication in correcting misinformation? And the development of patient-specific tools and behavioral interventions is key in this space. My approach with patients is pretty simple. I have what I would say is this 5-fold approach. I'm sorry. Whoa. build trust with them, empower them, recognize the role of their own lived experience. Acknowledge the role of their own lived experiences, acknowledge that they're going to use the internet, and give them accurate sources. Lastly, I just wanted to thank my lab members, those who work with me in researching this important topic, as we try to offer patients the best opportunities to improve their outcomes and to overcome the massive amounts of misinformation that exist online. I have lots of collaborators throughout the United States and internationally, and I look forward to future international collaborations. So if there are researchers here in Qatar who are interested in this topic, I'm happy to work with you, because this is a global health issue. And as a cancer prevention and control community, it's my hope that this talk has identified and stimulated interest in research areas that we can improve clinical care and foster implementation of new programs in cancer on misinformation, so we can basically propel cancer prevention research and intervention toward improving health equity for everyone.
Thank you, Dr. Johnson. Thank you very much for this eye-opener presentation, information, and mostly because it's based on real-life experience and researches and expertise of someone who spent years on this topic as an expert and a doctor researcher, but also as a husband and a parent. And I'm glad to see that your partner is doing well right now. This is like, it's very touching to see this. And thank you for whether it's, even if it's personal thing, but you humbly included it in this presentation. So thank you very much. And it was really an eye-opener presentation for me as an outsider of this field. But I hope that our audience who are joining us here, who are mostly professionals of health and or information, are also getting excited by this information. Thank you very much. I'm going to turn it over right now to Dr. Hadi Abu Rasheed. And thank you, Dr. Hadi, for waiting with us and being with us. So I'm going to just quickly remind our audience that you are the representative or a member of the Qatar Cancer Society in the National Cancer Governance Board in Qatar, and many other national and international committees and institutions. And I won't name them all here because they are many. And I want to say also that you have already organized and presented in more than 100 medical educational conferences and events, and participated in clinical research and trials in USA and Qatar. Thank you again for being with us, Dr. Hadi, and please go ahead, the floor is yours.
Thank you so much, Mr. Mohamad. I was not actually, I was enjoying every moment from Dr. Johnson talk. So I was, actually, it was my pleasure it's pleasure and also put me in a tough place to be after such a great talk like Dr. Johnson talk. And I want a great informative, and I really urge all the healthcare professional and researcher on this call, policymaker, to really take the opportunity of international collaboration and the topic of cancer misinformation, because, and in particular, and health in general, it's a very important topic. And also I want to take the opportunity to thank the US Embassy in Doha and the US Speaker Program and the USA Education and the Cultural Affairs team here in the US Embassy Doha, and the great team behind this event having it work and actually come to light on such an important day, the World Health Day. And particularly I want to thank Mr. Mohamad and Ms. Tracy for all the efforts, and they've been working very hard even during their leave back and forth to get this done. So I want to thank them all for all their effort to make this happen. So now I'll share my screen. So what I'm gonna continue and complement what Dr. Johnson finished. He finished in a very important note. He finished on the term of equity, and the equity of access to correct information, equity to the services, equity to be not to be placed on in a reduce increase mortality, increase the burden of cancer, reduce survivorship of people living with cancer because of not having access to all aspects of cancer control, which is one of it is the proper information and then knowledge about the proper pathway and how to manage their journey through cancer. So I'm gonna a little bit touch base a little bit about what we've been doing Qatar Cancer Society in this role, and also I'm gonna a little bit shed light on the let's say some of the available resources and available initiatives here in the state of Qatar. So I will start with give you an overview of what is the framework that we do in Qatar Cancer Society to make sure that we have equitable person-centered cancer control. Especially, we are a member of the UICC, and we've been trying to actually to spread the awareness about the equity in cancer control, as we are in the World Cancer Day campaign for the next 3 years is going to be about the equity in cancer control and cancer care. So we start with actually knowledge translation and research, and that's built on the great evidence-based information that is such as the Dr. Johnson presenting, having correct information not only for the public and cancer patient, also for the healthcare physician. So we work with the academic institution in the region and health institution and locally to have this information easy accessible to them, and that better knowledge lead to better access to diagnostic therapeutic services, and we help in collaboration with the partners. So people living with cancer, suspected cancer, they have access to the and here I want to take the time that we are lucky in Qatar to have a huge investment in health and in cancer control, and having clear strategy in the management of cancer control, that the pathway is such robust and up to speed to have a better access to diagnosis therapeutic services between the work of Ministry of Public Health, Primary Health Corporation, and Hamad Medical Corporation and Sidra Medicine, under the overall look of the Qatar National Cancer Governance Board. And next step, we'll been working with the people living with cancer to in the population level high risk, their family, is navigation to cancer screening service that is usually provided through the Primary Health Corporation and also in the private sector. And we are lucky here in Qatar that we have population-based screening for breast and colon cancer, accessible to everyone, resident and citizen, and without, and I'm happy to announce that all now the screening service is back after a short interruption during the COVID pandemic. And we've been working with the all health entity and academic entity is to even study thinking of new screening services, and at the same time help working on the awareness and the education of the primary care provider and the public about the best screening, what are the age group, who should do the screening, and defy all the myth information about this, and working also the health promotion and public health department and the Ministry of Public Health on events actually, and then Dr. Johnson mentioned it in the offline discussion. We've been working with the school, the social worker, with academic institution, even also we are planning to work on the religious leaders to defy all the myth about information about cancer. Then the next step, as I said, focusing on community cancer awareness, and in Qatar we have more than 45 different nationalities. So we've been driven by the leadership Ministry of Public Health and Communication. They've been providing throughout the pandemic in communication variety of languages, a variety of cultural perspective, and that play a role, very important role in equity in reaching cancer information and also the pandemic information. So and we've been when you have high standard in the country, we always try to strive to this standards. The other part of the framework is the psychosocial support and education for people living with cancer. guided with the evidence-based medicine, with the support and collaboration with the cancer community and the oncology community here. And all of that need to be supported by capacity building for health workforce. And this activity it has two goals. One is capacity building for health workforce. The second is spreading the awareness through the social media now, and then it will be streamed in Facebook channel, social media for the U.S. Embassy to reach the public. And this is very important to equip the primary care provider health workforce in the correct information, and through collaboration with the academic and health entity. And the last aspect is dear for my heart is the advocacy for people living with cancer. Advocacy that they reach better information, equitable information, advocacy for they get back to their work, be able accepted by the community, and advocacy through removing all the myth and information about people living with cancer that they cannot be important part of the community. And all of that, as you guys see, is done through partnership with all academic, health, society entity. Going through want to shed light of what Qatar has been doing for the cancer awareness and cancer communication. So here in Qatar, we are lucky that we are under the leadership of the National Cancer Governance Board in the Cancer Communication Working Group. All entity and stakeholders are sitting together and agreed on a cancer awareness calendar. As you guys see, every month we have awareness and prepare fact sheet and properly evidence-based medicine that it doesn't have any misconception. And we spread it through our social media channels, through our press release, through our even material brochures. We all agree on the material and spread awareness every month about different kind of cancer. And this is very unique, and I think being involved in a local, regional, international event and organization, we don't see that much, that all stakeholders sitting, agreeing on the material, the messages, unifying the messages, and then spreading it through our through joint social security, social media channels. Ministry of Public Health, Hamad Medical Corporation, PHCC, Qatar Cancer Society, National Cancer Program. This is the overarching umbrella, and Sidra Medicine. And that's one of the initiatives that tackle the misinformation about cancer. And this is, and the community awareness, one of the silver lining in the pandemic was we shifted to innovation and digital platform, and we've been able to reach more and more people. Despite that, we make sure to continue as much as we could because of the topic of equity in cancer control and who has access to social media and not. But based on study that done with the Ministry of Communication and ICT here in Qatar, there has been early in the pandemic that concern about the elderly. They will not have that much access to, they will not use the social media that much, but actually studies and survey in Qatar show that actually they have good access to social media here in the state of Qatar. And so we continue to push forward through digital media platform, and as we are now, we are back to adapted to back to normalizing with the pandemic. We're back to a live event and an awareness campaign as much stepwise approach to be vigilant with the pandemic status. And regarding importance of social media and cancer awareness, and the importance we need to have more research about it. We had a couple of conferences, papers, one in the Gulf Federation for Cancer Control, the other one in the Union International for Cancer Control, about the importance of cancer awareness in the age of social media. And we've been looking into the how we need to look more in depth and how we use this tool in a proper way. And this is the use of social media breast cancer awareness and the GCC country experience. So that's one of the areas that we've been exploring more, and we're putting more effort about this. And here I want to get back one of the point that Dr. Skyler had the discussion offline, and actually in his discussion. Here in Qatar, we've been also working in the research area with the great entity belong to Hamad bin Khalifa University and Qatar Cancer Research Institute about how we use social media platform like such as Saqar. It's a special platform for Twitter to check for any misinformation about cancer, to see what the trending information, and tackle it with better information and campaign about that. And also maybe in the future, this is one of the research projects we've been working on with them in a precision. We all heard about precision medicine, but now we are hopefully working on maybe precision public health through social media, targeting people in according to their persona. So we'll see, and we'll keep you posted about the research activity. Other thing, the psychosocial support for people living with cancer, and I think it's very important that we keep reaching them, even non-stop, not stopping their service and involving them through the pandemic. We were able to, with the whole entity in the state of Qatar, and actually none of the, cancer patient will be left behind or their therapy has been affected. All of them received the proper care. There was not that delay in their care, and also in their education through the social media and platform. And I'm happy to share that during the pandemic, we worked with the HBQ QCRI, and there was not that much of misconception about cancer and COVID in our local platform. And I'm sure this is all due to the robust campaign is done by the government communication through the collaboration ministry under the Ministry of Public Health. And the least is helping people living with cancer to access diagnostic therapeutic service and proper information. And that refer back to Dr. Johnson talk about knowing the information, give them the right direction and to diagnostic and overcoming any, let's say, navigate the patient in the proper way and overcoming any misinformation. And as I mentioned and mentioned again, is the importance of the capacity building and have proper resources for healthcare professionals to base their information about cancer control, like let's say about cancer prevention. We've been sharing, doing in collaborative with many academic institutions series about cancer prevention series for healthcare CPD or CME for healthcare professional, and we'll be having sessions soon this month, and also providing them with the proper service and proper resources. Like, here having this call, I will advise all healthcare professionals to reach International Agency for Cancer, IR, International Agency for Cancer Research website. They have amazing resources about all the science behind cancer prevention, and also World Cancer Research Fund. They have amazing facts and evidence about nutrition and cancer prevention, and also even for the public, there is a Qatar Cancer Society website, and also the Ministry of Public Health. They have many information, and our social media channel, all this partner of the National Cancer Program. And as I told you, that's never happened without partnership. So
thank you, Dr. Hadi. Thank you very much for this rich and very informative presentation and amount of information. Thank you for sharing all your expertise and knowledge with us today. Again, I can't thank you enough, you and Dr. Johnson, and hopefully we get the chance to do more of these events in the future. So I was looking at some questions in the chat box, and one of them is about Skyler website or a URL, Skyler?
Yeah, so that's Saqar. It's actually service provided through Qatar Computing Research Institute, and they could communicate with them, and they have this. It's a service that they provided, and they could collaborate. It's called Qatar Computing Research Institute, QCRI. It's part of Hamad bin Khalifa University. They provide services, and we've been, they've been. We are lucky. We want to thank them for their support, and you could look for Twitters and even not only in English, in Arabic, and know what's the trend there about the terminology, and you could, do plenty of things. It's a great service, and we are proud of the achievement of the local academic and research institute.
Great. Do they have a website or an application?
Yeah, I could put the link in the chat.
Great. Yeah. Please. Thank you very much, Dr. Hadi. And I'm sorry because I'm an ignorant of these things. but I'm
No, no.
I'm learning very well and very fast from the best. I'm learning from the best.
Don't feel. I mean, that's one of the things. Qatar is advancing quickly, like in a like a full speed ahead. No one will be able to catch up with all the achievement that Qatar has. So
yeah. And we are glad really at the embassy to see all these beautiful achievements in Qatar, and we celebrate them with you and with the community. I'm going to move on with a question to Dr. Johnson. And then I will check other questions and we will see whether they are for you or for Dr. Johnson. So Dr. Johnson, are there like specific or very, very famous online resources to do fact checking, or maybe powerful? The question is like about resources to do fact checking, but I think people are trying to get some insight about powerful tools that might be available online or through mobile applications to do fact checking about misinformation, about information about health and or cancer in general. Do you have an idea about such resources?
Yeah, I can comment on cancer specific resources. I think that there's a few really good, I mean, there's obviously high quality information out there. And I think one of the things that I try to do with patients, because we need to acknowledge that they're going to go online to look for more information about their cancer, for their, their treatment options. And in order to try to help prevent, the inundation of the misinformation, you have to lead them to the accurate resources. One of the resources that I really like is there's a Cancer Research UK website, which is a nonprofit charity website. I'd be happy to post their link in the chat. Also, in the United States, I generally point people to the National Cancer Institute's website, as well as the American Cancer Society's website. They all have really great resources that fact check a lot of the claims that are made about cancer, particularly on social media.
Thank you very much, Dr. Johnson. And the next question, I think it's already mentioned in the question. It's for Mr. Dr. Hadi, and it's about the Middle Eastern perspective. So it's Manal, it's from Manal. She's saying that unfortunately, after looking at the Middle Eastern perspective, there is a lot of conflict and maybe lack of incorporation of culture in cancer care in our countries. And she's saying that we might need to look into these factors when being patient-centered institutions. I think this is not really a question, it's like a suggestion on sharing idea. Any comment, Dr. Hadi?
First of all, I want to say Ramadan Kareem, Dr. Manal. She's a great, I mean, Oman Cancer Association is more a twinning institution with us as Qatar Cancer Society. And Dr. Manal, she has, I mean, no matter what I say is not enough. She's been a real advocate for people living with cancer. She's the dean of the nursing school in Oman. And she, I mean, and I totally understand we need to do more and more collaboration for fact checking information, for misinformation, for doing research in this area. The collaboration is very important, and putting emphasis on sharing resources, sharing concept, and this is such an important point she raised, is the collaboration and overcoming any kind of focusing on the more important is at the level of, on the small differences. But here in Qatar, we are lucky that we are all collaboration with all stakeholders, and I think the region is moving forward more and more toward collaboration. But we are lucky in Qatar that everyone is sitting on the table.
Yeah, great, Dr. Hadi. And I think the good point here to mention is that as you are representing Qatar Cancer Society in many regional and international institutions and committees. So I think people in the region have the possibility or the opportunity to reach out to you and to seek advising or opportunities of collaboration. And you already know Dr. Manel. So thank you for joining, Dr. Manel from Oman. We are glad to have you with us today. And Ramadan Kareem to you and to all the people in Oman. And I will seize the opportunity to kindly ask you to reach out to the US Embassy in Oman and try to find ways of collaborations like what we do in Qatar. And we are glad to connect you with our colleagues there for possible collaborations. Please feel free to reach out to us or to our colleagues in the US Embassy in Oman. I'm gonna move with the next question. I think this is for Dr. Johnson and maybe you also, Dr. Hadi. It's about community initiatives to combat misinformation, whether in the USA or in Qatar, or if there are like success stories or successful experiences in Qatar that Americans can implement or copy or get inspired by, or vice versa, like an experience from the US that can be used here or implemented in Qatar. Over to you, Dr. Johnson.
Yeah, it's a great question. So in terms of things that are being done to address the misinformation, there are funds that are actually being set aside by the federal government of the United States to research specifically the role of misinformation in public health. So there's a research side that's being kind of set aside. But to answer your question, kind of how does that, what's being done to impact communities? I've seen some really great programs that actually has kind of a grassroots community-based efforts, specifically as it pertains to vaccination, and not just like COVID vaccine efforts, but like HPV vaccine efforts, things like that, where the grassroots efforts are basically to enlist the help of community leaders, trusted individuals within the community that people listen to, and to basically create collaborations with these community leaders to push, basically put forward public health, policies, and to work with them in that regard. And that's been really helpful. There's some like highly religious spaces within the United States where they've used those individuals to help increase vaccination efforts and to curb misinformation in that space. And I think that's a really unique and important approach.
Yeah, great. What do you think, Dr. Hadi? Do you think that these initiatives can be implemented here in Qatar by the civil society? And
definitely. I could share an example that I've been involved in, and not. I'm gonna share an example from the US. So the American Cancer Society, they have this global. They have the global arm, and they've been working on a piloting excellent tool for cancer patient navigation called Beacon. And I've been involved in that and in kind of giving feedback about how that fit the context of the region, and even offering maybe help later on when they are gonna translate it to Arabic to proofread from medical and Arabic perspective that tool, and it's been piloted in a certain country, and it hopefully when it will be fully released, I have a great feeling about it, and that could be used. And then later on, maybe translated will be implemented in our region. So I definitely, and there is many initiatives, and we have an international organizational in the US we've been partnering with, and we are glad that we're going to add University of Utah on the list. And there is, I just want to, Mr. Mohammed, there is a question in the chat and the Q&A, if I could. It's already, I think Dr. Skyler already answered it.
Yeah, no, I just briefly put in a text response, but I'm curious to hear what you have to say about it?
Yeah.
So,
Dr.
regarding
Hadi, go ahead. Yes.
using the law and misinformation here in Qatar, we've been lucky that, I mean, during the pandemic, actually, the Ministry of Public Health, the Ministry of Information Technology, they've been, if anyone spreading information that lead to harm of health and misinformation lead to, they will be actually, if people report them, they will be communicated with to clarify this information and actually kind of stop this communication, and they will trace back the case and they will know who actually. So there are law perspective about misinformation, and Minister of Public Health been very adamant about it. Not a level of the public, even sometimes, unfortunately, you know, I mean, like I had the discussion with Dr. Skyler, I mean, earlier, in some healthcare provider, they have this own belief that they put out there that has misinformation, so they will be communicated, corrected the information, all of that. And there is another point, Dr. Khulud from Ministry of Public Health, she put in the chat. I totally agree with you, Dr. Khulud. We really need to invest more in community participation and community participatory program, and having more program driven by the people living with cancer, having them at the center of designing, implementing any program. Very important point, because that will, they will, if they have ownership, they will understand how they actually, the information, the educational information, they will be written in a language they understand more than our assumption as a healthcare professional of what makes sense to them. Back to you, Mr. Mohammed.
Yeah, thank you. That leads me to maybe the last question, but we will still, we are still watching the chat box if other questions will come, which is about information in Arabic. That's a big deal, you know, information in Arabic, and sometimes it's even challenging to design or to develop tech solutions to do fact checking in Arabic, as we in the Arab world, we have more like tens of local dialects, and we mix characters and we mix different things, and sometimes we use two or three, like 3 or 4 or 5 dialects in one sentence. And I think this is something that makes it a bit hard to track information that is circulating in Arabic. So I would love to hear from you, Dr. Hadi. Is there any efforts being like developed, or have you seen something like an online tool or an application that you could recommend to do fact checking of health or misinformation in general that is in Arabic? Sorry for the long question, but I'm trying to formulate.
No, it's a very valid point. So here in Qatar, I mean, like an example, resources for cancer information, there's Ministry of Public Health website, Hamad Medical Corporation, Sidra website, they have a cancer patient information, and even if people, they want to actually go to like, they have a patient education on site in the Hamad Medical Corporation, in addition to online, let's say on the website or social media, they could go physically to the hospital. They have a patient education library. Even here in Qatar Cancer Society, they have, they could come and read and have more resources. Qatar National Library, they have amazing, by the way, I urge people to use, I mean, let's say if they want, I mean, online, get resources, or even go to Qatar National Library physically, and if they want to hold the book, they could read information about the disease, and it's free of charge. It's an amazing resource. As I mentioned, if there is any trend of misinformation, we actually, Saqr will be on Twitter. It's actually, and they are maybe looking forward into having more information, including more tools, so we could see what are trend information, and then we could identify a program to tackle if it's been a trend of misinformation. But and when people have any question, feel free. They put a question in all of social media, HMC, Qatar Cancer Society. I mean, it's any, I mean, resources in the Arabic language. Also, even the Arabic language, by the way, resource in the US. I mean, I frequently refer to Mayo Clinic Arabic. Mayo Clinic Arabic. It's, I mean, I like even the way that the Arabic language is written in it, it's easily understood in the Arabic. So
great. Thank you very much, Dr. Hadi. And this should be the last question. This is what my colleagues are telling me. And thank you again, my dear colleague Tracy and Asil, who are doing a great job behind the scene to secure all the logistics and the tech side. So Dr. Johnson, this question, or maybe it's a comment saying that relationships are influential. So the question is, what are you doing to tackle misinformation in your personal networks? And maybe this is a question to all of us, that because we all can contribute by sharing the real facts or combating misinformation in our personal network. So yeah, please go ahead, Dr. Johnson.
Yeah, so it's one of those things where I feel like, kind of like I said in the answer to, should the law be more involved in the spreading of misinformation? And I view misinformation almost like an infectious disease because of the way that it spreads and it can become viral. I mean, we use these terms that are almost kind of, analogous to the spread of a disease. And when you talk about misinformation, I think what we need first responders, and we need people to really attack misinformation like we do a disease when it first presents or rears its ugly head. And one of these kind of old idioms that we hear is that a lie can travel around the world before the truth can get its boots on. And so we really have to act fast, or else, these lies can travel quickly. So one of the things that I'm a huge proponent of is healthcare providers, because in our survey data, we know that healthcare providers are still trusted resources for accurate information, that people in the public in general trust healthcare providers, that we need to speak up when we see misinformation, that we need to correct misinformation, and we need to be active participants in that, just like we would in the spread of diseases.
Yeah, and I think we all have like some roles to play in combating misinformation in general. Thank you very much, Dr. Johnson and Dr. Hadi, again, for being with us today to share your valuable knowledge and expertise. Thank you to my colleague Brandy from the medical unit at the US Embassy. And please, Brandy, chime in if you want to add any last comment. Thank you to everyone in Qatar or outside Qatar who joined us. Thank you again to my colleagues Tracy and Asil, who have been doing a great job behind the scenes. We look forward to more collaborations with Qatar Cancer Society, with you, Dr. Hadi, with you, Dr. Johnson, and other Qatari institutions and organizations to address issues of common concerns. So does anyone want to add anything, like last comment before?
Yeah, I just wanted to offer my final thanks for the opportunity to be able to talk at this important panel. And I appreciate all the efforts that people have put forth to make it happen. I'm including my email into the chat box for individuals who'd like to contact me about maybe future collaborations and research about misinformation.
Thank you, Dr. Johnson, for sharing your email. And definitely we will keep the conversation open running through emails, and anyone here in the chat box, feel free to reach out to us and we can connect you with Dr. Johnson, Dr. Hadi, and help as our capacity allows. Dr. Hadi, any last comment?
Thank you so much. I cannot, it's actually was an honor and pleasure to learn from Dr. Johnson today and hear of his great research. And I want to thank him and his whole research team. And I want to thank the US Embassy again, and Doha Cultural Affair, and the US Speaker Program in US Education, and all you, Mr. Mohammed and Tracy, and the rest of the team in the behind the scene. And I want to pleasure to meet Miss Brandy, and definitely will be reaching out for educational activity for healthcare professional, involve her.
Thank you, and like a remote thank you to our friend and colleague Ammar
Definitely.
from Qatar Cancer Society
Definitely.
for collaborating to do like
from our public relationship. Yes, definitely.
And all your colleagues at Qatar Cancer Society. Thank you very much, and see you in the future events. Bye-bye.
Thank you. Bye-bye.